Where are you operating today from? Are you finally in a home QTH? Or you've been on the road a lot on the weekends? Over?
Okay, for FL, UA2 BBQ and the group. Today I'm at home, transmitting through Blue TV straight to the internet. Over.
Very fine. And I know you were working one time recently at the hospital. So I'm glad you're able to be at home for us today. Hopefully, it's a nice restful weekend as well. This is AA4FL getting ready for the Medical Amateur Radio Council digital voice net at the top of the hour. The only other stations like to check in early, make your call to AA4FL.
In 5 RTF.
Good morning, Jeff. N5RTF, AA4FL. Any other stations for early check-in? We're about to start the net. Go ahead and make your call now. Okay, I see from NetLogger that K3FZT Steve is with us. So, Steve, I'm going to go ahead and log you in. Thank you for joining us today. And it's just about the top of the hour here. This is AA4FL J, operating today from Delray Beach, Florida, and the Medical Amateur Radio Council Net that's just called to order right now at the top of the hour. Uh, Individuals do not have to be members of the Medical Amateur Radio Council to participate, to check in, to be involved in the roundtables. We will talk about many different topics, some very congenial ham radio topics. There may be some medical topics that we discuss as well, but we're welcoming any amateur radio operators who have an interest in medical topics to participate. Certainly, it's good to hear input from the amateur community, even without having a professional degree or a degree in a career in a health-related field. Not required as long as you have an interest in it. And we are a directed net. Let me let it drop one, and we'll go over a little housekeeping rules. As you noticed, I'm trying to keep my transmissions under 2 minutes. In addition, once I drop, we're allowing for a pause. Someone else is transmitting and it's your turn to transmit. Please do pause for up to 5 seconds. The QuadNet array is a wonderful collection of technological integrated items to make transcoding possible for us to communicate with different digital protocols, but make sure to give time for all these different devices to sync, since we're dealing with hotspots and repeaters and you name it. People come in all different ways, and just give it a little bit of a rest, a little bit of chance, and hopefully the performance will not be an issue. And certainly respect everyone. And it's net directed net will give opportunities for people to have new discussion threads as well. But net control here will start the initial discussion thread. Now, that being said, are there any stations here that have priority emergency traffic for the net? If so, make your call to AA4FL. AA4FL, none heard. I do have 7 of us checked in so far. Myself, WA1EXA, N4TSC, PY2BPQ, N3IM, N5RTF, K3FZT. Now, if any of us are only able to be here for a short time or mobile, please let me know at this time. So I'll move you up in the roundtable discussion. Please go ahead and call AA4FL if you fit those criteria. Well, no one is here with those needs. I'm asking for stations who would like to check in. Again, if you're not a Marco member, fine, please just check in so that we know you're here. Even if you don't want to be involved in the roundtable discussion, it just helps us to direct the answers to our questions in a more, I say, directed way, more focused way. So anyone that would like to check in that has not already, please make your call to AA4 FL Net Control this time. Very good. No additional check-ins. Will allow for check-ins later. Hopefully, those of you using NetLogger see the instant message window, and Hilton is just given the live streaming link on the menu there on the instant message window. And this is a week from here in Florida. Well, lots going on nationally. Kind of quiet down here, actually. It's not tourist season in Palm Beach County. We're in southern Palm Beach County, down from Palm Beach, where all the national activities have been in the last week, probably about 20 miles. And we're almost down to Broward County, about 10 miles from Broward County. And from the standpoint of mask wearing, I still do see individuals with masks here. Certainly, it's not the norm, it's the exception. But with the recommendations coming out this week for no social distancing, it's changes afoot. So I guess practicality rules right now, and we're getting into towards the issues with other diseases and other seasonal viruses. So hopefully we'll hear your observations of what's going on locally. That being said, I may take a trip to see Warren next weekend. Stop in for Warren and say hello. I may be headed down there to Pinellas County where Warren lives and spend an afternoon with him, try to get there for the grand rounds a week from Sunday. This is AA4FL Net Control. How do you drop one? Are there any stations that have not checked in that still would like to check in for the net? If so, make your call now. None heard. WA1EXA, Mark, are you with us? If so, please go ahead and make your call. And for TSC, Jerry, I'm sure you're monitoring, and you probably don't want to be involved in the roundtable now, but I'll go ahead and call on you at the end here. When Hilton is here, PY2BBQ, I'm going to let him take the mic next. Go ahead, Hilton.
No, okay. Now I think I'm transmitting fine. A4FL in the group. This is PY2BBQ, Hilton from São Paulo, Brazil. Nice to be with you again. The last few weekends I've been very busy, as Jay had just said. Um, each 12 weekends, me and my team, we stay on call in Albert Einstein hospitals in the general surgery service. So that happened, and we had a lot of surgical operations during the weekend. It was really tough. But this weekend, I'm I'm free, and tomorrow here in Brazil it's the Father's Day, so we'll have a lot to celebrate. So concerning COVID-19, things are pretty stable here, calm. In São Paulo state, we are giving the second booster for every adult over 18 years old, and the children over 5 years old is being already vaccinated. So uh, things are pretty calm here regarding COVID-19. And another thing I wanted to say is that I just received the Ether August issue, and I would like to just say that was a really very nice articles, the immunotherapy article, and also many others regarding aspirin, and so let me wait one. Okay, PY2BBQ returning. So as I was saying, it was a very nice issue, and I enjoyed reading all the articles. And I'd like to congratulate everybody involved in this last issue. So that's the story here in São Paulo, Brazil. Winter is going on. Last week we had a rainy and cold week, temperature in the lower 50s, which is pretty cool for our standards. I think this week we are going to have a better weather over here. So back to you, Jay, and the group A4FL PY2BBQ, over.
In QSL, Hilton, I'm holding that issue of the ether in my hand right now. I'm going to reread it here. I briefly had looked at it, but I see what you're talking about in those articles. They look excellent. I'm starting to determine what will go in the next one, and probably will shy away from much in the way of scientific stories, but articles. But we'll see. There's still time to develop that. I'm just going to focus quite a bit on our archives as we're starting to get into our archives and make them available online. And we'll still got about 6 weeks to work on it. Since our deadline's a little bit later than Warren's, being that it's electronically distributed. And of course, his additions are quite appreciated. And he's certainly a sage, a wise individual of many years of experience, both journalistically and in the medical field. Thank you for the compliments. I'll pass them along to him when I see them, Hilton. And three, I am. Keith, go ahead.
Well, there's not a lot to talk about here. This is entry. I am with AA4FL. We've had some really warm days, nice, nice weather at times. Few thunderstorms with downpours. We're looking for more sustained rain that is soft and gentle because our grass is brown. Um, Had a kyphoplasty for one of my fractured vertebrae from falling off the ladder. So that's taken care of. And overall, we have been a non-mask society for the whole up here. Occasionally you'll see an individual still wearing a mask. But yeah, last night we had an exciting time. Break one. We got a call from a friend of ours that there were 4 longhorn cattle, or cattle with long horns, but not necessarily longhorn Texas cattle, in our neighborhood. Apparently they got out of somebody's pasture and were in our neighborhood running around. So that's it from Pennsylvania. This is M3IM with AA4FL Group. Back to you, Jay.
Nice having you here, Keith. I'm glad to hear you're getting some of those broken parts mended. At our age, getting on ladders is problematic, and being amateur radio operators, we tend to do things that are not necessarily in the best interest of our health. I'm starting to feel uncomfortable on a ladder, and certainly will be curtailing it as much as possible. N5 RTF Chat. Good morning to you, Nolan. Where are you operating from today? AA4FL and the group, N5RTF. We're operating from the French Quarter this morning. It's sunny day. All of the rain that we've had for the last 2 weeks has moved toward Texas, and I hear that they're looking forward to it. So everything is good from that standpoint. We had a long line of mostly men around the corner from a station that was giving monkeypox vaccines a couple of days ago. And
AA4FL, we lost Chip.
can you hear me now?
Yeah, I hear you now. We lost you as you were talking about the line for monkeypox vaccination.
Yeah, that was the end of it. I was pleased to see that they were offering that in 5RTF. Perhaps as we go to our next round, we'll talk more about the monkeypox status. Again, I still wish I knew someone that had some expertise in the area. I haven't asked Jack if his wife did, but she's pediatric infectious disease. Certainly, it'd be nice to have a scientific article on monkeypox, and of course, we chose to reprint from somewhere else with permission. So, could always do that. Find a reliable source and ask for permission to do a reprint. With credit. This AA4FL net control for the Medical Advocates Radio Council DVNet. We have one more participant here, actually 2. But Steve, K3SZT, why don't you go ahead and take the mic?
AA4FL and the group. This is K3FZT. Well, good morning, all. I missed you last week because I was up on the North Fork of Long Island, and although I brought my Clear Zero, which would transcode to DMR, I chose to spend the morning with friends visiting various yard sales and having brunch with some folks I hadn't seen in several years, thanks to pandemic and all. On the pandemic front in Philadelphia, last week we were listed at a high rate of transmission, and it decremented this week to a moderate level. On the monkeypox front, I will repeat an anecdote without attributing to a particular provider or even state that a older couple entertained an older heterosexual couple entertained a medium-sized group of friends and friends' offspring at a pool party, and the day after they heard from a friend that a early 20s offspring had just been diagnosed with monkeypox. The woman of the family, who had, of course, handled towels and such that had been used by guests, sought vaccination, since vaccination is effective in avoiding the illness if administered within 4 days of exposure. Wait one. And in speaking to several public health personnel in the venue where this couple lived, this woman was told repeatedly that she didn't need the vaccine because she was a woman. So lots of misinformation out there about monkeypox. Jay, as a resource, I would tell you that I have really narrowed down my reading on all this interesting but fire hose flooding of information. And I read on Substack Eric Topol's writing, and also a Substack posting called Your Local Epidemiologist. I will put links to both of these in the almost instant messenger window while you pass it along to Andy. AA4FL. This is Steve in Philadelphia, A3FZT.
Thank you, Steve, and thank you for sharing that information about the resources. This is AA4FL, and for ID purposes, the Medical Amateur Radio Council, TVNet. And what Steve was referring to is the instant message window on our NetLogger, I believe, for posting those links. So if you have that NetLogger, please do review that. Otherwise, I'll try to copy and paste that, post it to the listserv. We've had an additional check-in here. Speaking of the instant message window of NetLogger. Excuse me for a minute here. Trying to do too many things at a time with the keyboard in the hands. We have WJAB Andy with us here this morning. Andy, why don't you go ahead and take the mic?
Well, good morning, everybody on the net. Just got here. Just hear the last transmission before that, so I got the part about the party in the monkey box. We've been waiting for the last couple hours because the relative dropping her dog off. It's supposed to be here at 9. Yeah, so that'll work out. I'll get to my net. Well, they showed up at 2 minutes to 11, so they didn't stay very long, so I am going to make it. Kind of missed the first part. So, most of my information on monkeypox is in what is in the news, and that's not necessarily from medical sources, although some of it's from the CDC. That's usually from I'll get stuff in the Washington Post, which I do read, and it is. Apparently, the vaccine is very effective, and unlike many vaccines that take several weeks to work, as you mentioned, can have some effect as early as 4 or 5 days. Apparently the vaccine has been stockpiled for some time, so they have some, but not enough, or the outbreak continues to get much more severe. So I did have one family member come down with COVID. He was fully vaccinated and boosted, young, only 46, but he went to a concert and did not have his mask on, posted his pictures, and guess what? Omicron variant, BA5, apparently got it. So he's improving. I think he'll be okay. So that's all I have for the moment. We'll be here for a while. Back to you, Jay from WJAB.
Well, thank you for joining us here today. I know it's a busy start to your day. Appreciate that. By the way, Steve has posted the links that he was referring to. I'm going to go ahead and copy them now and send them to myself and try to make a list or a post later. Let me do this here before I forget. Excuse me. Multitasking is not as easy for me as it used to be. Seems when you're a dentist, you're just used to hitting curveballs all day long, and it seems to be getting a lot lazier that way. I don't seem to be quite as sharp. I know what the problem is. I haven't been doing Morse code. See? So, copying Morse code, I'd be sharp, be able to react quickly to everything in life. So, I need to join Chip there on the CW net. Okay. I went ahead and sent that to myself, and we'll post that later. Thank you very much for that, Steve. And Andy, thank you for joining us here today. I'm going to go ahead and see now if Jerry N4TSC has this equipment working. Would like to say hello. Jerry, go ahead. This is AA4 FL, and we'll give you the opportunity to take the mic.
Okay, thank you, Jay. I'm not sure that anyone can hear me. I'm having problems with the MD380. I've been monitoring you. I cannot hear Hilton, and I'm also having problems getting the live feed through the internet, but I am trying, and I'll just keep monitoring. Hopefully, you guys can hear me. Back to you, Jay. AA4FL and 4TS.
No, QSL, Jerry, actually copied that entire transmission and heard the feed in the background. It seems like it was on in the background while you were transmitting, but also Andy WJD has commented on NetLogger that he's hearing you just fine. So if you want to say a few more comments, Jerry, go ahead in 4TSCAA for us.
Okay, A4FL and 4TSC. Well, first comment is that I was able to eventually find a feed on the internet, but it's probably 20 or 30 minutes delayed, and that's what you were hearing. Also, the workaround that I've got right now is to keep my MD380 plugged into the power supply, and I'm trying to contact you that way. The other thing that I noted was when I was looking at the vaccine that was made for monkeypox, it said it was also in combination with smallpox, and I wonder whether the vaccine is the same or it is a combination that's being used, and I wonder if anyone has any comments on that. Meanwhile, let me turn it back to you. AA4FL, hopefully you copy me, and 4TS.
Well, copy you beautifully. I'm wondering if the battery that you have just is not in good enough condition to transmit, and that it is for listening, and you drop when you start to transmit. In regards to Jerry's question about monkeypox and smallpox, the vaccine for monkeypox having a component for smallpox, and whether or not that's true. Does anyone else have information about that here? So go ahead and make your call to AA4FL. We'll make a list of responses. No responses here, Jerry. So perhaps the resources. I know you were on NetLogger because I saw you check in. So Steve had posted some resources. Perhaps if you use those two, the epidemiology ones, you can find an answer to your question on those sources, perhaps. Otherwise, internet searches should probably be pretty effective. You can find a reliable source. So this is AA4FL with the Medical Image Radio Council Digital Voice Net. Are there any other stations that have not checked in? I would like to go ahead and check in. You don't have to be a Marco member. You may have a question from the discussion threads you just heard, or you may just want to introduce yourself to the group. If so, go ahead and make your call. This time to AA4FL. Okay, no other check-ins. Are there any other discussions that one would like to bring up today? On one comes to mind that we haven't discussed recently is polio, and I suppose there was one case, and from without any study, it seems that one case was indicative that there's a lot more involvement, since apparently cases only occur in a certain low percentage of exposures. And of course, the wastewater, I don't remember where it was that polio was showing up in. So if anybody has any input about polio, please go ahead and let us know. We'll start a discussion thread. This is AA4FL.
Comment K3FZT.
Okay, Steve, we have a station WA3KKB that's monitoring. But go ahead, Steve, and go ahead and make your comments.
With respect to polio virus, the New York Times today, Saturday, reports on its front page below the fold that polio virus is being found widely in New York City sewerage. This is an alarming finding since finding this fecal oral virus in the sewerage gives us reason to be concerned about widespread risk of exposure in a population that was under-vaccinated throughout the pandemic. And I'm not referring to we baby boomers on this net, mostly baby boomers on this net. I'm referring to young children who are, by all reports, incompletely or even not at all vaccinated at a much higher rate than historically. K3FZT, back to me.
QSL, Steve, I'm going to pose a question, and I'll let you start with that. The question is, since it's apparently a younger generation, and a number of people that have not taken vaccines, is the COVID-19, I would say, the inhibition of individuals to get vaccinated, do you think that might be increasing the overall reluctance for vaccinations? Is there a certain group that's just anti-vax in all ways? But do you feel within this information on the internet that perhaps have been facilitated by or increased by COVID-19? Do you think that might be a factor? Because there's always been anti-vaxxers. We haven't seen the polio before if it had been monitored. K3FCT, AA4FL.
AA4FL and the group K3FZT. Well, thanks for that question, Jay. You've opened up the opportunity for me to speculate. I will try to be reserved and circumspect in that regard, mostly referring to an op-ed piece also in today's New York Times by Farhud Manjoo, who is writing about the Alec Jones trial outcome and about the coupling of health misinformation with conspiracy theories. And so I caution everybody that this is speculation on the part of the op-ed author, that I am relaying and possibly mangling in the process. But between that piece and other things I have seen, it seems clear to me that there is a growing portion of the population who is not trusting of mainstream media and mainstream medicine. And I think that is cause for concern. And do I think it is leading to a growing number of children not being immunized on schedule? Again, there are reports about this in the pediatric literature. So I think it's a big problem. But again, I say that's speculation. Back to you, Jay, K3FCT.
QSL. Thank you for sharing that, Stephen. It seems like there's a huge distrust, and has been mentioned by others on the net here today, in authorities and government, etc., in the United States. And certainly there's many sub-communities now with the internet and support and talk groups and social media where like-minded people can find each other. So I guess it seems that human nature, people seek what they feel comfortable in, and the reality of what they believe is sometimes what they want to believe. So I guess it's just going to come down to if it's a freedom to choose. Then when it comes to vaccinations, it's going to fit into that reluctance and not acceptance. However, if it was, as Hilton has told us before in Brazil, that it's separate from politics, and there they have high rates of compliance because everybody gets vaccinated because it's considered a public health issue and not a personal liberty issue. Hilton, would you like to comment some more about that TY2BBQ, AA4FL?
Okay, A4FL and the group. This is PY2BBQ returning very interesting issue. J and the group. That's all the alarms on. We all thought that polio was already eradicated worldwide. Almost 40 years ago in the medical school, we learned that it's an enterovirus that spreads very easily among children, and about 1% of the infected children only will develop the peripheral neurologic issues of the disease, and most of the infected either won't have any symptoms or only a mild diarrhea. So that's the problem. It spreads very easily among the children that's not immunized. So, as you said, Jay, and we had said before, it's not an individual right issue. It's public health, and this vaccine must be given on demand for every children. It's not a choice, of course. It's a worldwide issue, and it's not related to only to individual rights. That's my thought, and that's the way it seems to work in countries. Let me wait one. That's the way it seems to work in countries where most of the healthcare is given as a public health issue, so uh, uh, it's everybody's responsibility. Well, so that's very concerning. And during the COVID-19 pandemics, not only the vaccination overall vaccination rate for every other disease decreases, but also uh, the cancer prophylaxis also decreases, and we see now many patients with breast cancer that didn't do mammography the last 2 years, and patients with colon cancer that could be prevented doing colonoscopy. So that's a great issue. Okay, Jay. So regarding the deniers of the vaccination, I would like to say a saying from the Italian Umberto Eco about social media. He said that social media gives legions of idiots the right to speak when they only spoke at a bar after a glass of wine without harming the community. But now they have the same right to speak as a Nobel Prize winner. It's the invasion of the idiots. So I think that's what we have been seeing in the internet among those deniers, those anti-vaccination people. So back to you, Jay, A4FL QY2BBQ.
Thank you for the explanation, Hilton. Steve K3SVT has been posting some additional links about the subject thread about deniers and influencers on the internet that might be influencing others to have out of the norm cures or perhaps not taking vaccines. In the New York City area, you've mentioned some populations, or someone had mentioned, that might be less vaccinated. So knowing what we know about the Alex Jones case, and that particular case is pretty obvious. But thinking of polio, something that just hasn't existed for 40 years, many of you mentioned that our generation knew the scourge of polio, and certainly the baby boomers and older. So there was no question about how effective the vaccine was and how prevalent and serious the disease was, affecting even presidents. So the question I have, knowing what happened in the Alex Jones case, for example, if say you had a religious community, which some in New York are, if the religious leaders said do not take vaccines for religious reasons, or just some other internet influencer that was that could be culpable because they were a celebrity. If they offered that advice, is this a clear-cut case where they could be sued for similar reasons for harm and damage? So just an interesting concept. If does anybody like to pick up that thread, I'll leave it out there to make a list, and I'll be taking those calls. AA4.
N3IM.
Okay, I'm sure I am. Keith, go ahead and take the mic. This is AA4FL.
A4FL in the group. This is N3IM. A couple comments. One is that a lot of people have refused to have their children vaccinated because they think it causes autism. And that's been going on for many years, more than I'd like to remember. The other thing is we have populations in the United States, such as the Amish, who do not get vaccinated, and usually the cases of polio we see in the United States are in that population when we do see one. Great. Great. The other question I have is about the smallpox vaccination. I'm sure many of us had the smallpox vaccination when we were younger. I happen to have had it 3 times. Once when I was young, once when I went to college, they required a smallpox vaccination, and again when I was in the Navy. So I don't know if 3 smallpox vaccinations helps against monkeypox or not, but I understand they're similar viruses. This is N3IM with AA4FL in the group. Back to you guys.
Yeah, QSL, Keith. I assume just about everybody's had smallpox vaccination, so well, the disease been gone. I assume that was in our armamentarium when we were children. Maybe I'm wrong. It's not my area of expertise. But if so, there's still people getting monkeypox. So I guess your question or the pondering cases, if you have a 3-time vaccination against smallpox, would that give you protection against monkeypox? To look on the internet and research that, unless anyone here has that background knowledge to offer input on the subject. I'll make that the mic available for anybody that does have that expertise. This is AA4F. I'll go ahead.
N5 RTF.
N5 RTF, go ahead.
Yeah, I wanted to remind you that our best resource
Jeff, I don't know if you finished your transmission, but you dropped right after you said our best resource.
I'm using Yaesu today. Warren.
Understood, and Warren's probably written many articles on polio through the years. We certainly can ask Warren to cover that in the next edition of Ether 3 months from now, or if he wants to contribute a scientific article to what I'm doing, I can certainly ask him that. Thank you for the suggestion, Jeff. Any other comments? AA4FL. And none heard. Any other discussion today before we bring the net to the close? This is AA4FL. Climate Radio Council TV Net.
K3FCT.
Go ahead, Steve. K3FCT, AA4FL.
I've taken the liberty of reviewing the CDC site on monkeypox and smallpox vaccination while the net's been running. And Hilton, thanks so much for running the YouTube stream every week. Appreciate it. So my review of the CDC website postings on monkeypox and smallpox, I think one of the guys mentioned about being immunized against smallpox 3 times. I can remember 2 immunizations, in fact, against smallpox. In fact, the second one was done by my dad, who was an internist, before I went overseas at age 15. In any case, the CDC's recommendation is that if you're more than 3 years post smallpox vaccination, that you have a dose of monkeypox vaccine if you have for post-exposure prophylaxis, although it's likely previous smallpox vaccination will have some effectiveness, but that's the way they say it. Also, as far as I can tell, the currently in use vaccine is not bivalent. I say this with caution that I did not see such a declaration, but I also did not see anything that said the monkeypox and smallpox vaccine in use was bivalent. So the absence of data doesn't mean the negative. That's all I've got. 73, everybody, and I'll be listening out. K3FZT, Steve, in Philadelphia will be clear.
Thank you, Steve. I appreciate you looking the information up and reporting it to the group quite well towards answering the questions. Any other follow-up comments before we bring the net to a close? If so, make a call to AA4FL. Well, thank you to everyone who's here with us today for the DVNet. We appreciate your friendship and your participation and look forward to next week. I'm not sure how much the subject material will expand in a 1 week's time, but we certainly have a number of different discussion threads that are all viral in nature. If you find more information in the next week, please be prepared to present it to the group. And if you find information that you would like to present in the ether, since it will be a timely issue 6 weeks from now for that edition, please pass those articles and links to me directly. This is AA4FL, as Andy says. Have a good weekend here, as he says on the instant message window of NetLogger. And this is AA4FL calling the net to a close for this week, 730 AA4FL, Livinfield QRT as well.
N3IM 73, and we're QRT.
AA4FL, what's the name of the net? AC6ZZ.
Hi, Donald. Thank you for asking. AC6ZZ, AA4FL. The Medical Amateur Radio Council Digital Voice Net. We meet every Saturday at 1500 UTC. And don't have to be a Medical Amateur Radio Council member to join in. The entire amateur community is welcome. Any further questions? Go ahead.
Thank you very much. I've been listening but have no idea what you're talking about. AC6 said that I'll be clear.
Okay, Donald. Well, today mostly we were talking about some of the recent challenges in the uptake of viruses, things like polio that were pretty much eliminated, smallpox the same, and the effectiveness of the smallpox vaccine towards monkeypox, and also polio. Uh, when you see resurgence, something that was so commonly eliminated from for those of us that are baby boomers or older. So, discussion amongst most of us here, we're dentists or physicians today, but not all our members are. Anyone in the amateur community is welcome to join Donald. AC6ZZ, AA4F1.
Thank you very much. Have a great day. This is AC6 said Zen. Again, I'm clear.
And AA4FL doing short.